Welcome to Diseases with Dr. Deer. Today we're going to be talking about canine parvovirus, also known as parvo. Canine parvovirus is a highly contagious virus that affects unvaccinated or under-vaccinated dogs. Like its name suggests, canine parvovirus is a virus, and it's very common and very contagious. It's also very hardy, meaning it's resistant to common detergents and disinfectants, and can persist in the environment for a long time. It can persist outdoors at room temperature for up to 2 months, and can persist indoors for many years. Parvo is most commonly seen in puppies, though under-vaccinated dogs and dogs that do not respond to the vaccine can also be infected. Certain breeds appear to have an increased risk. There was an old-time saying that black and tan dogs tend to not do as well, and we see that with breeds like Rottweilers, Doberman Pinschers, German Shepherds, and Pit Bulls. Any breed of puppy can become infected by this. Puppies are afforded some protection in their first few weeks of life due to maternal antibodies. These are given to the puppy through colostrum of mothers with antibodies and slowly wean over 6 to 8 weeks. This is why vaccination schedules for puppies begin around that 6 to 8 weeks of age mark, as it allows time for the maternal antibodies to wane so they can mount their own immune response. Again, the mother has to already have these antibodies, so she should have either been fully vaccinated for parvovirus or already unfortunately been exposed to parvovirus. Infection occurs via the fecal-oral route. An infected dog will shed the virus in their feces. The virus then replicates in the oropharynx and then disseminates and leads to clinical signs within 2 to 14 days of infection, though we generally see signs within 5 to 7 days. Clinical signs include vomiting, diarrhea, fever, anorexia, and lethargy. They can have profound dehydration and they can develop hematochezia or bloody diarrhea. As the disease progresses, it can affect their immune system, leading to low white blood cell counts and bone marrow suppression. If a mother is infected in utero or puppies are born to mothers without antibodies, symptoms are different and often include heart issues. Thankfully, due to great vaccination schedules, we don't really see this very often. Diagnosis is generally made with an in-house SNAP test, though other tests exist. Patients that are very ill or very early in the disease may have false negatives and test positive through send-out tests that your vet may recommend. If an unvaccinated or under-vaccinated dogs with signs consistent with parvo test negative, sometimes we treat this patient as though they do have parvo. Treatment is mostly supportive care, though there is a new treatment for canine parvovirus called Canine Parvoviral Monoclonal Antibody, or CPMA. This was released in the United States in 2023 and is an injection that acts like maternal antibodies. It keeps the parvovirus from entering the enterocytes. In the preliminary study, all puppies treated with only CPMA survived, whereas 50% of the untreated puppies did not. There are limitations to this study, such as the puppies were administered the treatment on the first day they tested positive, but overall, this is very optimistic for future treatments of parvo. Otherwise, most parvo treatment is symptomatic and supportive. These patients are given anti-nausea medications to help with vomiting, antibiotics to prevent secondary infections or to help with bacterial translocation, fluids, feeding tubes, and electrolyte support. There's emerging evidence about using fecal microbiota transplantations from healthy dogs as well. Prognosis is variable and based on the immune system of the puppy and their response to care. With hospitalization, it's estimated that 70 to 90% of dogs survive, and without hospitalization, the prognosis is closer to like 50%. Dogs that recover likely have lifelong immunity. Possible complications from parvovirus include intussusception, which is a telescoping of the intestines and requires emergency surgery. Thankfully, there isn't compelling evidence of there being long-term GI issues secondary to parvo. However, most of the dogs infected are puppies, so there are concerns about behavioral issues that arise due to isolation and need for hospitalization during their fear periods. This is not well studied and mostly anecdotally described. An appropriate vaccination and boostering schedule can help prevent parvo. Most puppies are started at 6 to 8 weeks of age, with a booster every 3 to 4 weeks. Depending on your location, the final puppy series will take place between 16 to 20 weeks of age. In endemic areas of parvo, the last vaccine is generally given after 18 weeks of age. This is then boosted 1 year later and then every 3 years. Because parvo is so hardy in the environment, care should be taken when socializing young puppies. Avoid parks or fields and stick to places that have known biocontrol methods. Surfaces should be cleaned with bleach diluted 1:30. There are other cleaners that target parvo, such as accelerated hydrogen peroxide disinfectants. Talk to your veterinarian about an appropriate vaccine schedule for your dog based on your location and your pet's lifestyle. If you're concerned that your puppy is sick, seek immediate veterinary care.